Hello, my name is Harry Van Bommel, and I'm your instructor for this course on family caregiving. My background is as an author of 56 books, half of which are about family caregiving, and I've been teaching and doing family caregiving for about 40 years now. I believe that we need to start with the basic assumption that to care for someone, you must care about them, and as a family caregiver, we assume that that's a given. My background personally is as a patient, a son, a grandson, a husband, father, friend, and neighbor. Professionally, I am a writer, a management consultant, a healthcare advocate, caregiver educator, and a caregiver project leader. I have been providing care, as I say, for about 40 years. Every day, you have an opportunity to make a dramatic difference in someone's life. Every day. And every day the difference you make enhances your life in immeasurable ways. This is a mutual gift. It's a wonderful gift, and I hope we all use it well. The motto for this program is to nurture relationships above all else. It seems like a given in most people's lives, but so much of our time, our actual time, is spent doing things, working, studying, shopping, vacationing. But what we need to spend even more time on is nurturing the relationships we have. And caregiving is one of those opportunities where we can do that. Who should take this course? The course is designed primarily for family caregivers, but of course it's also for the patients at home or in a hospital or in a long-term care facility, and for those professionals and volunteers who provide care. Ram Dass wrote a book called How Can I Help? In 1987. And in there he describes a particular patient's experience with chronic illness. Let me just read her story for you. I have been chronically ill for 12 years. Stroke, paralysis, that's what I'm dealing with now. I've gone to rehab program after rehab program. I may be one of the most rehabilitated people on the face of the earth. I should be president. I worked with a lot of people and I've seen many types and attitudes. People try very hard to help me do the best on my own. They understand the importance of that self-sufficiency, and so do I. They're positive, they're optimistic, and I admire them for their perseverance. My body is broken, but they still work very hard with it. They're very dedicated. I have nothing but respect for them. But I must say this. I have never, ever met someone who sees me as whole. Can you understand this? Can you? No one sees me and helps me see myself as being complete as is. No one really sees how that's true at the deepest level. Everything else is band-aids, you know. And I'd like to give you an example of another person who wasn't seen as whole. This was a 70-year-old father and grandfather with facial tumors and living on a palliative care ward. He wanted to die. He had all the support of his family, his friends, his faith community, but he couldn't stand anymore the faces of people entering his room, looking at his face and the tumors that were there, and the shock in their face or the pity in their face. And so he just wanted to die, and his wife concurred with that. But this man also had a 6-year-old granddaughter. And if any of you have ever been a granddaughter, you will appreciate this story. Because this little girl wanted to see Grandpa one more time. And the grandfather and the grandmother and her own mother, who was this man's daughter, all didn't want her to come to visit because they wanted her to remember him as he was, they said. And the palliative care team of doctors, nurses, social workers, and chaplain agreed with this man's decision not to let her come. But he had a very persistent 6-year-old granddaughter who kept nagging and nagging and nagging until finally they relented and said that as long as they could prepare her before she went into the room, that she could go visit Grandpa. And so they sat her in a room near the nursing unit, and the physician and a nurse and a social worker helped prepare her. But just imagine a 6-year-old sitting in a chair, looking up at the ceiling, bored out of her mind, waiting to see her grandfather. And you get an idea of what this little girl was going through. Finally, they said, you can go. He's down the hall at the end, room on the left. And so she ran down the hall, and she pushed the door open quickly, and she ran to her grandfather on his bed and gave him a big hug and said, I love you, Grandpa. Please don't go. And so she saw Grandpa as her grandfather. She didn't see the tumor. She didn't see the man dying. She saw her grandpa. And that is what I mean by seeing someone as whole. And that is the image that I hope you hold on to as you continue through this course. I asked my grandfather at the age of 92 once, I was taking care of him at his home until he died, what he missed most in life. And after thinking about it for a while, he didn't mention his wife or his 10 children and his 35 grandchildren, or his work or the medal he won for his outstanding citizenship. What he said finally was he missed his mother. And this is a 92-year-old man. Again, we need to see not just the older man or the younger child or whoever we're caring for. We need to see the whole person. So seeing someone as whole is the greatest gift that we have to offer to the people that we care for. There's a lot of practical things we'll talk about during this course, but this is the beginning part, seeing them as whole. Often in society, we continue to divide people into us and them. And part of the assumption of this course is that everyone, both those who are providing care and those who are receiving care, are equal. And so it's not about us caring for them, it is us and them together caring for each other. It is a mutual gift. My role in this online course is to help you move from good instincts to good insights, so that you know the things that you are doing well by instinct will now become something that you consciously do and do more often. What is not covered in this course, in the material, I have put online for you to use freely, and we'll talk more about that in the last unit. And the basic assumption around home and healthcare is that we are trying to meet the physical, the emotional, the spiritual, and the information needs of your loved one and you. And so we're going to concentrate on all of these aspects and how best to provide the support to your loved one, but also to take care of yourself. So a summary of today's introduction unit is that every day you can make a dramatic difference in someone's life, in the person you love, every day. Nurture relationships above all else, and we'll look at more about how to do that. Seeing people as whole, as they are, rather than as the condition they may have, or having had surgery, or having a baby, or whatever reason you're caring for them. Concentrate on the whole person rather than the reason you're providing that care. Those you love are always with you. And so as you go through this process, even when you are outside of the room or outside of the environment where you're providing care, they are with you and you are with them. And so the relationship you build and enhance throughout this process will be a benefit to both of you. And we're looking at how to become excellent in meeting the physical, emotional, spiritual, and information needs of your loved one, and how to do that. Now let's begin. This course is divided into 12 parts. We've gone through the introduction. The next module will be on first things first. As you can see, we'll be looking at home care examples of what excellence looks like, providing basic care, how to navigate the healthcare systems that are involved in your loved one's health journey, family and friends visiting, how they can do that better, how to help teenagers and children to be more help during this process, what to do if you're caring from a distance when your loved one's in one town or city and you are in another, what legal issues to consider, questions to ask and when to ask them of doctors, nurses, social workers, chaplains, and others allied professionals, and how to create your own support team, both for your loved one but also for yourself. And then we end the program on what's next. How do you go from this basic introduction forward? See you at the next module. Bye-bye.